in the name of Deputy Eugene Murphy. 30 seconds to introduce.
Well, I just want to ask the Minister for Health if we will see significant improvements in the ambulance service provision in 2017, and I'm particularly interested in my own constituency of Roscommon-Galway. As you know, rural Ireland has to be looked at in a different way in terms of ambulance cover. There's a problem with timelines and response times, and that's not acceptable in terms of getting to people in rural Ireland. Delivery of unrealistic timelines for ambulance response in rural area is not being tackled, and patients are being left waiting.
2 minutes.
Thank you very much. I want to thank Deputy Murphy for raising this important issue, and it's one you've raised with me before. The National Ambulance Service has undergone a programme of modernisation in recent years, and a number of significant service innovations and developments have taken place. These include the establishment of a National Emergency Operations Centre, a state-of-the-art facility from where all call taking and ambulance dispatch is now undertaken. The centre also houses the Ambulance Training College. We have had substantial investment in new technology and new fleet to help improve ambulance service provision. The Intermediate Care Service has been introduced to provide inter-hospital transfers for some lower acuity patients, as we were already discussing, and this is freeing up more emergency ambulances for more urgent calls. Of course, we've also established the Emergency Aeromedical Support Service to provide rapid access to appropriate treatment for very high acuity patients in remote rural areas where access by land ambulance may be difficult or may take too long. I am fully conscious of the need for a multi-annual programme of phased investment in ambulance manpower, vehicles and technology. In that regard, I want to assure Deputy Murphy that increased funding will be made available to the National Ambulance Service for 2017. The detail of the improvements to be funded will be provided in the HSE's 2017 National Service Plan, and over the coming weeks my department will work closely with their counterparts in the HSE and the National Ambulance Service to agree priorities in relation to the 2017 allocation, and I will reflect the Deputy's concerns in that regard.
Deputy Murphy.
Minister, I know that you did address this in relation to a deputation you made from Roscommon University Hospital, and I want to thank you on that occasion because there was a great expression of views. But, you know, the Lightfoot Solutions report commissioned by the HSE, and I think it came out in May, stated that the National Ambulance Service Review requested 750 more staff and 250 more ambulances to ensure delivery of a safe and swift service. Now, only 1 in 15 ambulances are reaching patients in need of emergency care within the 8-minute target in rural Ireland. That is not acceptable, considering that 60% of patients in rural Ireland live another 45 minutes or more from an A&E. And if you're in central Roscommon, that is the reality in trying to get to Galway. The least we can do, Minister, is to ensure that emergencies are dealt with in a timely fashion in relation to the ambulance. Now look, our A&E has been cut, and other A&Es have been closed in rural Ireland. And the one thing we have to get, and we were promised, was a proper ambulance service, and we need that in the constituency of Roscommon-Galway.
Again, thank Deputy Murphy. I suppose 2 points I'd make in relation to the Lightfoot capacity report, which I'm familiar with. It was the first thing that landed on my desk when I became Minister for Health. And I suppose the first point is that it needs a multi-annual funding plan. I don't think anybody in this House, or indeed anybody working in the National Ambulance Service, would believe that we can implement all of the recommendations in the Lightfoot report in 1 year. But what we can do and what we must do is show progress year on year. And I recently met the unions representing our ambulance personnel, and indeed I visited the National Ambulance Service Coordination Centre to talk about this. So you will see this coming year, 2017, more funding spent on our National Ambulance Service than this current year, and this current year will have spent more than last year. But there is also another point which you touched on in relation to ambulance response times. And the Lightfoot report, an external report from the UK, first ever done into our ambulance service, did say even if you were able to put in, and they're not all even available if you had the funding, all of the ambulance personnel and all of the extra ambulances, you'd still have an issue in rural Ireland in terms of how our population is dispersed compared perhaps to the UK. That does involve, according to Lightfoot, looking at the role of community first responders, also looking at the role of the air ambulance as well. So these are issues we've got to be honest with each other. Even when we make the improvements to the ambulance service, these target times are going to need new ways of being examined.
Deputy Alan Kelly.
Thank you, Claire. Quick question, Minister.